To a joint session of Congress. Correspondent Nancy Cordes is at the White House.
About 35 million Americans watch the State of the Union every year. So this one speech might be President Trump's biggest chance to shape the Republican message ahead of this year's midterm elections, where control of the House is going to be up for grabs. So you're going to hear a lot tonight about the economy, about the stock market going up, gas prices going down.
A suspect's now been charged in the death of a young woman aboard a cruise ship. Correspondent Christopher Cruz has the details.
Court documents obtained by CBS News show a 16-year-old stepbrother of Anna Kepner has been charged with homicide. The 18-year-old Kepner was on a Caribbean cruise with her father, stepmother, and 3 step-siblings on the Carnival Horizon. Her body was found by a housekeeper under the bed in her room. A law enforcement source says investigators believe Kepner may have been strangled during a fight and that the suspect may have drunk alcohol.
Ford is recalling 413,000 SUVs because the steering may give out. WWJ's Jeff Gilbert.
There have been 2 crashes, but no injuries connected to the issue with 2017 through 19 Ford Explorers. Corrosion can cause the rear suspension toe link to fracture. Owners would notice a loud noise or unusual handling.
The Dow is up 401 points in early trading. This is CBS News.
Looking for spring jewelry looks? Find them at Jewelry Television. New customers get $20 off purchases of $99 or more at jtv.com.
Carpal tunnel syndrome, heart failure that doesn't improve with common medicines. These are some signs and symptoms associated with ATTR-CM, or the cardiomyopathy of ATTR amyloidosis, a serious heart condition with symptoms that get worse over time. Amvuttra, vutrisiran, is a prescription medicine given by a healthcare provider that treats ATTR-CM in adults to reduce heart-related death, hospital stays, and urgent visits. In a clinical study, Amvuttra was proven to help people live longer and have fewer heart-related hospital stays and urgent visits over 3 years compared to placebo. Amvuttra lowers the amount of vitamin A in your blood, which can affect vision. Other side effects include pain in the arms or legs, pain in the joints, and shortness of breath. These are not all the possible side effects of Amvuttra. For prescribing information, call 1-833-256-2748 or learn more at amvuttra.com. Ask your doctor about Amvuttra for ATTR.
2 powerful FM signals, 1 AM signal, and online at WGNSradio.com means that you can listen to us anywhere. AM, FM, online.
Whether it's a cough, a fever, or something you can't quite name, MMC Now makes care easy. Walk right in, get seen quickly, and your visit connects directly to your MMC doctor. Care you trust, with providers you know, with digital check-in and multiple locations around town. MMC Now is here when you need us.
Murfreesboro Medical Clinic.
We're the Good Neighbor Network, FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna, audio and video streaming at WGNSradio.com. This is The Roundtable, a look at the news, views, politics, and people that are shaping Rutherford County.
And good morning, everybody. Welcome to the Tuesday morning roundtable show with Rick and Wayne. And how are you, Wayne?
I'm fine. Good morning, brother. I think we're still in the throes of the grip of winter. You know, it's still a little cool.
They say it's going to be a lot better this weekend.
Well, it certainly was cold on the baseball field.
It was tough yesterday,
weekend.
wasn't it?
So I missed the Sunday practice. But Saturday was plenty cold just by itself. So, hey, did that little varmint see its shadow or not? Do you know?
He did see a shadow.
Okay. And that means what?
That means 6 weeks more of winter weather.
Okay.
And, of course, what just hit the Northeast? The worst storm in history.
Oh, wow.
That's what they're saying.
Yeah.
I got some family up there and around the Delaware area, and they've got more than 10 inches than they've ever had.
But just think, we're already 10 weeks or 4 weeks into the 6 weeks, so just 2 more weeks.
All right. So, okay. We won't have to shoot the little sucker then, will we? So, hey, Rick, can I do a quick public service announcement?
Who's it for? Let me think
Isaiah
about it.
117. Strings of Hope, a night with Craig Campbell and friends. It's a fundraiser from 5 to 8 at the Walnut House. For more information, just go to their website. And of course, we've had Beth on the show several times to talk about the good work that they do.
That's right.
And we just, want to see them have a successful fundraiser.
I do, and being Craig Campbell there, I have an event I have to be at, but I'd love to just go and listen to him play. Yep. I follow him on. I don't know if you follow him on social media. That guy is he's naturally funny, but he just bought a Tesla, one of those totally driverless Teslas, and he took it from.
Are they called autonomous?
He put his address in at home, and of course he's got a old country place out in Eagleville, and he didn't touch the steering wheel from the parking lot of the dealership all the way home. And he said, now my driveway is narrow and it's this and that. He said, oh, we're going to see what it does. And it took him in there, and then it turned away from where his garage was. And he goes, oh, where's it going? Where's it going? And then it stops, and it backs it up in there because their plugs are in the back.
Oh, my.
So he never touched the car. So anyways, I enjoy, just seems like he'd be one of the ones like you, Wayne, that you can just have a conversation with.
Well, thank you.
Come away from it being happy.
But I'm not letting the vehicle take me anywhere. That's where the similarity ends, brother. So
I get it.
Yeah. Got a fun show today, Rick. This morning, Mr. Bradley Pyron is with us. It's fun for me, especially. Brad is my daughter Hillary's fiance, which will make him my son-in-law, which I'm very pleased to know. And Brad brings quite a bit to the family table. He has two sons, Lanning and Layton, which are blending in with Riley and Oliver, and I'd say when they're all four together, that their house is probably a little chaotic. But the other thing Brad has is his parents, Greg and Tracy. I don't know that I know two finer Christian people, and just such a blessing to get to be with them. Greg is a retired professional driver for UPS. His mom, Tracy, has been involved in some type of medical from, prosthetics, possibly in sales and medical invoices, and just wonderful people. And his sister is a fourth grade educator in Wilson County. Tucker's Crossing, recently recognized by the Wilson County School Board for excellence in the classroom. So, just really neat to see the family grow the way it has with such amazing people. And Brad, of course, Hillary's a nurse practitioner, and Brad's a CRNA, which education and medical professionals, they love all these acronyms, and but I'll let Brad talk about that a little bit. But good morning, son.
Good morning.
Glad to have you.
Glad you have me here.
Well, I usually try not to talk that much on the introduction, but your parents and your sister and your children, they're just so much fun to be around, and just felt like I had to give them a shout out. I know you well as well. Yeah. So, but maybe tell our audience a little bit about what you do, and then talk about growing up, because you not only are you highly educated, but you were quite the athlete growing up as well.
Long time ago. So I do anesthesia. So kind of in short terms, I put you to sleep for surgery.
Not euthanasia.
Not that. You don't going to sleep's the
easy. That's a huge difference.
Going to sleep's the easy part. We get paid to wake you up. So
yes. Good. Okay.
I primarily do cardiac surgeries at St. Thomas West. Do a little neuro, lungs, just kind of hit or miss wherever they need help. I'm originally from Memphis, grew up there, graduated high school in Arlington, which is kind of outside Shelby County. Went to undergrad at Union University in Jackson, Tennessee. Graduated there 2014 with my nursing degree. Worked in Jackson for about 8 months, and then moved up here to Nashville. Worked at St. Thomas Rutherford, kind of right after it turned into St. Thomas Rutherford. I believe it was called MTMC, Middle Tennessee Medical Center.
Yes, sir.
So I worked at St. Thomas Rutherford for 2 years, and then started anesthesia school at Middle Tennessee School of Anesthesia, which is in Madison, Tennessee, east of Nashville. Was there for 2.5 years, graduated in 2019, and have been at St. Thomas West since then.
You had a taste of Murfreesboro when you were in high school because you played in the state baseball tournament.
I did. I probably couldn't remember exactly what school we were at because I didn't know where we were. But yeah, it was a good experience. I was one of, if not the youngest kid on the team that year, and it was kind of a, Brad, you're coming to play with us kind of a thing. I thought my season was over, and it was a good experience.
Well, you know, anytime you get to play, even if you don't win the state, but to be in the state tournament, I think what a big deal.
Yeah, we definitely didn't win those games that I played, but
well,
it was a good time nonetheless.
I know that even now working with the kids, your knowledge is, you know, as far as your athletic background has certainly benefited, you know, all four of the kids.
Right. Big thing is, you know, what I try to teach the kids is, you know, I don't want to try to live vicariously through them at all. You know, I don't want to make them want to do this or just do it because I did it, you know, kind of a thing.
Sure.
I don't, you know, because you can tell if a kid really enjoys doing sports.
You know, of course, the reason I wanted you on the show, other than, you know, I enjoy being with you, is that, you know, now having passed the big 7-0, you know, having had both knees replaced, a laminectomy, and, you know, other surgeries, you know, anesthesia is a concern for, I think, maybe not for the younger set. I don't know, you have to let me know that, Rick, but as far as at my age, you know, put me under, you know, causes me a little bit of anxiety, if you know what I mean.
Yeah. I think it is a, you know, conception that people don't talk about a lot. They think about the surgery and how the surgery is going to go, and they talk about the risks and benefits for the surgery procedure, but, you know, we don't get to preoperatively see any of these people. You know, I meet you 15 minutes before we roll back.
That's right.
And it might not even be me that meets you. You know, it could be one of the other CRNAs that is helping out. I'm busy in the back, or I'm with another patient. And, you know, we've built so much trust to work as a team that, you know, if one of my buddies comes back and says, hey, you know, they did this or took this medicine or this, that, and the other, you just kind of know to just take it with a grain of salt and just keep rolling, kind of a thing. And I think that's more of a nerve-wracking thing for people than anything is, you know who your surgeon's going to be. You don't know who your anesthesia provider's going to be, right? And
Sure.
You're stuck with them. You know, you don't get to just walk in there and go, well, I don't want that guy, or I don't want that woman. I want such and such. Like, now, if you know people in the hospital, we can kind of work things around that way, but you know me for 15 minutes, and then if I do well, you don't see me again. You know, so that's the goal.
You know, with me, and my children and my family would tell you, I don't like to fly. I mean, I will, but I don't like it. And anesthesia is a little bit like that, you know. You sometimes you just have to have surgery, and you don't particularly want the surgery, but you particularly don't want the anesthesia because you're a little bit afraid of it, I guess.
Yeah.
And that's probably the unknown and so many things because of your health and your weight. And
well, I mean, everything kind of rolls into that. It's funny that you say you don't like flying. I kind of always say that doing anesthesia is kind of like being a pilot. It can be bumpy on the takeoff. It's usually cruise control throughout the surgery, and then you got to land, and that landing's waking up. And like I said, you don't pay anesthesia providers for putting you to sleep because that's the easy way to do it. You pay us to wake you up. So,
yeah, I can't imagine. I guess too soft. I can't imagine living in the olden days when you had to have a tooth pulled or surgery.
Oh, with ether, with the mask and ether.
Or even before you had
that's
ether.
true.
You know?
Jim Beam.
Yeah. That and a brick.
Five swigs in 5 minutes. We'll get this over with.
Yeah, and I don't want to get too off track, but in the Civil War, when the amputation was the surgery of choice because of gangrene and infection and stuff. Was the ether available?
I'm not entirely sure. I know they would give these people morphine, which doesn't put you to sleep. Right. So, it's a first line drug we give to people with chest pain. Right. Morphine, oxygen, and aspirin. So it doesn't put you to sleep. When I had my first experience with anesthesia, I guess, is when I was in high school. I broke my arm. I kind of tell this. It's kind of a funny story. So, broke my arm in half. Had to go to the orthopedic guy. He put the most old-fashioned thing you've ever seen in your life. I just thought, this guy, there's no way he's a doctor. Those Chinese finger things you put your fingers in, you can't pull them out. Well, he had that draped over an IV pole. Put my two middle fingers in there, my ring and my middle finger in it. He draped sandbags over my arm, gave me an IM, so an intramuscular morphine shot, and he goes, I'll be back in 5 minutes. He'll numb it up. Knowing what I know now, that's not how that works. Came back in. I'm looking at my dad, and I'm like, Dad, I still feel my arm, My dad, he won't say this, but he's got a weak stomach, and he was like, I love you, and stepped out, And
I would not have guessed that about
he reset my
Papa
arm.
Greg.
I promise you, I'd have rather broken my arm again than having that reset. And I tell you, the first clinical rotation that I was in anesthesia school, they called me and they go, hey, we need to go to the ER. I'm like, okay. So I go over there. High school kid broke his arm, and I put that man to sleep. And I was like, where was this 10 years ago when I could have done it for me? And I was like, well, you're lucky, buddy. Now, knowing what I know now, I got the short end of the stick.
Ooh, that makes me cringe just thinking about it.
I think outside of my wisdom teeth, I've not had any surgeries. And let me knock on some wood on that. So I'm 55 and not had any major surgeries, but other than wisdom teeth. So,
and that's you played football, you played baseball.
I'm not saying there ain't work that needs to be done. I'm just saying I ain't had it done.
You just chose not to.
I mean, he was almost 30 years in law enforcement for the town of Smyrna.
Yeah,
and no surgeries.
Mm-mm. And that's probably what put part of the fear in me. I mean, I was an officer in the 90s and starting early 90s, and that's when crack cocaine and the whole thing with prescription drugs started really taking off, and I watched it ruin families. And I've always been very worried about taking medications because I've seen some very people that Wayne and I know, and it's destroyed their lives. I was like, man, I never want to get myself in that situation. And so I've always got to a certain point, I have a real bad arm, rotator cuff and the whole 9 yards. And Dr. Johns years ago, I went in and he says, well, Rick, it's about time. And I had that conversation with him when I was playing at MTSU. And I said, all right, I'm going to take off the rest of the year. I'm not going to do anything. And and then come back. Well, I never went back to him because I never went back. And then and at 40, my wife and I thought it'd be great to play on an intramural softball team. And I played third. A guy hit a ball to me, and I threw the ball the first, and my arm went with it. And we were in the third inning, and I got through the inning, and I went, and I started taking everything off, putting my bag, and my buddy's like, "Hey, man, what are you doing? It's the third inning." I said, "Nope, that's done for me."
Done for you.
And I went out, and I've never, and I play golf or something, but I haven't been put under, but I've been in the back of a ton of ambulances and in hospitals for car accidents and things that we would have cases on. And I watched the advancement of medicine, just like you were talking about, because when our paramedics were EMTs and then they went to paramedics, there's a little bit better drugs they could give. And then when they go to the advanced school, then they could start giving the little Schedule 1s and stuff and with cardiac stuff, and the advancements that they were doing right in the back seat of an ambulance was amazing to me. And like you said, where was this 10 years ago when they were working on your arm? But same thing. I used to watch Dr. Willie was a ER doc in Smyrna, and I felt like he was, he was doing voodoo medicine because of what the things he did and everything compared to what they did today.
Right.
I guess watching events unfold like with Michael Jackson and Prince and the stuff that they took, I guess it just made you shake your head going, what was the people around you thinking?
You see some of these things. I will preface this with the medications that, Michael Jackson, he's the one that kind of gets the big rap of doing all that. I'm not trying to make any enemies out here, but it was a cardiologist that prescribed him all those medications.
Was it ketamine?
It was a lot, Versed or midazolam, what some people say. A constant infusion of propofol with no one there to watch him.
That's it. Yeah.
Propofol is the white milky medication that we
That's
give.
what they call I don't care juice.
Yeah, the I don't care juice. And some of the people at our hospital call it the thriller killer. We try to make it as good as we can, but it is a dangerous drug. I mean, it disinhibits your brainstem, and that's how it works. It just makes everything shut down.
Wow. So depending on what the surgery they're having and maybe the medications they're on, you got to be pretty versed in far as what you're able to give and how much to give per person, right?
Right. So, everything, especially working with cardiac, it kind of works a little different. I would say the average person that I see, a normal ejection fraction. When I say that, it's your heart function. A normal heart function for, everyone walking around should be 60%, which you hear 60% and you think, oh, that's not good. But 60% is normal. I would say a normal day at my hospital, I might see 5 patients whose EFs add up to 60%.
Oh, wow.
It's not uncommon for me to see patients that their hearts just don't work well. And if I give someone who's got an ejection fraction of 8-10%, the same amount of medications I would give someone that has a normal heart function, you don't wake up.
That's right. Yeah.
So, and that's, you use other medications. We use more benzodiazepines or opioids and stuff like that that are more hemodynamically stable. So it kind of keeps your heart rate, blood pressure, and the whole 9 yards. And then ketamine has been a real big proponent of, it helps with pain regulation as well as you don't really remember anything that's going on after that too.
So is there different anesthesia for, like, if you have a cardiovascular surgery or you have
a knee replacement?
Yeah, or something else.
So that's something that kind of gets thrown around. And again, everyone's only getting 15 minutes of this, before surgery. I hear some of the attendings and docs will say, "Are you ready to go to sleep?" They're the surgeons. Well, they're not doing any of this stuff, nor do they know what I'm doing in the first place. They just see me behind the drapes, and as long as I'm sitting down with my feet propped up, usually that means everything's going well. But so you'll hear anesthesia providers throw around these words like, "Oh, it's MAC," or "It's a general," or "It's it's just a spinal."
That's right.
When you get your knee replaced, I feel like that's a more common surgery that a lot of people get you get a spinal, which is just not exactly the same thing as, people having babies. It's an epidural. Spinal's a little deeper. It lasts 2.5 hours. Theoretically, you don't need any more anesthesia than that to have your knee replaced. You could be wide awake and have have that done. You don't feel, or you can't move.
You just don't want
to.
You just don't want to see it going on,
right? And so we give people
when they pull out the dent puller and everything else.
You don't want to hear that the hammer banging. So the going to sleep parts for the patient.
Sure.
Just they don't want.
YouTube's not your friend when you want to have any of that.
Yeah, Zach told me not to watch.
Don't ever do
that.
No one's ever got their medical degree from Google.
What is? I've heard this term before. They put you in twilight or something like that.
So
what is that?
That would be more geared to the MAC. It just stands its acronyms like you talked about. Monitored anesthesia care.
Okay.
System sedation. What that means, for you is you're breathing on your own.
Okay.
I'm not putting you on a ventilator, not putting a breathing tube in. You're just getting medication through your IV that'll get you to sleep. And you just don't know what's going on. And then we'll wake up, and I would say 99 times out of 100, when I wake people up from that and they're like, continue the conversation that we were having beforehand. And we're like, all right, we're done. We're going to get you back to your bed. And they're like, we're done?
Yeah.
And that's it.
Well, when I had my knees replaced and had the laminectomy, was something breathing for me? Or
when you had your knee replaced, no.
No? Okay.
When you had your laminectomy, yes. So with laminectomies or anything in your back, you have to be put on your stomach. It's not easy to intubate somebody, and when I say intubate, put a breathing tube in their lungs upside down. So if something goes wrong, you need to have a secure airway, and the only secure airway you can have is being on the ventilator.
Okay.
So you're for those surgeries, what we do is you come into the room on your bed. We put you to sleep on the stretcher that you came in there with. After you're asleep, then we flip you on your stomach. And then when we're done, I don't wake you up. I'm not going to wake you up upside down. That would be a scary thing because, you just blink. 6 hours might have gone by, but, for the patients, they close their eyes and they open them back up. You don't want to be upside down. So we flip you back over, then we'll wake you up. So it's...
you don't remember that way?
It's all about safety.
No. Thankfully, I don't recall any of that. Just the older you get, I guess I don't know as far as percentages or ratios as far as being put under, if you will, or made to go to sleep. I guess is there a formula as far as the risk of exponentially increasing as you age?
I wouldn't necessarily say it just as you age, because there's a lot more that goes into that. You have, when you get older, it doesn't mean you're just as healthy as you were when you're 35.
Sure.
Your heart function's probably not as good. Your lungs might not be as good. Everything that may seem little that you have under control with medication kind of gets thrown out of the window when you get put to sleep. Because basically what I'm doing is I'm disinhibiting everything in your whole body, and I'm doing the work for you. If you come into the hospital and at home you wear 4 or 5 liters of oxygen all the time, there's a pretty good chance I'll be able to get the breathing tube off of you, but it would be a higher chance that you might have to sit with a breathing tube in the recovery room for a little bit longer because your lungs aren't as good to oxygenate without being on the ventilator. Same thing with hearts. You get somebody that's got a really poor heart function, all the medication that I give has to be circulated with your heart. And in anesthesia, you hear about circulation time or circ time. You give people less medication and you wait longer. So you give them less medication, and just because it doesn't work right away doesn't mean it's not working. You got to give it time because it takes longer for it to get where it needs to go because your heart function's not as good.
I can't imagine maybe having a patient that's really, really healthy, maybe he's a runner, just, eats right and not overweight. And then all of a sudden you get a patient that's, this nation, we're pretty much obese.
Oh, yeah.
And smokers and not extra. I can't imagine trying to figure out what I give this one who's really, really healthy, and I give this other one who's not so much.
Yeah. I think with the kind of surgeries that I do and the type of people that I see on a regular basis, at our hospital, we don't transfer people out. So it's kind of like a last stop. There's no canceling cases at our hospital because, the heart function's too bad. Well, we're here to do heart surgery.
Yes, sir.
So that's, I've almost grown accustomed to it being easier for me personally to put someone to sleep who's quote unquote sicker, than someone that's healthy, because you get in that mind frame of can't give them too much, can't do all this, and with the healthier people, they'll take a lot more. I work out at a surgery center as well in Mount Juliet, and it's nothing but healthy people out there. You're not having surgery at a surgery center and you're not a healthy person, and it's just insane to start my day at a surgery center and I give, a certain amount of medication, and go to the main hospital and I won't give that amount of medication that I gave at the surgery center in a week or two at the hospital, and it still has the same effect.
Sure.
It's a lot of practice.
It's amazing how everybody in that room depends on each other, from the surgeon to the CRNA to whoever else is in that attending that surgery.
Yeah,
procedure.
I think big thing with anesthesia providers, you have to be calm under pressure. If things start going wrong, it's your job to figure it out. When you go to surgery and you're having your, rotator cuff repaired, that surgeon's there to do the rotator cuff.
Mm-hmm.
He's not there to make sure you do well after surgery.
Right.
That's not his job. His job is to do the rotator cuff, and then he's gone. The circulator's there to go get whatever, the room needs. First assist is there to assist the surgeon, help close up. And it's my job as an anesthesia provider to make sure you go through the procedure safely. There's been many a times, and like I said, what a surgeon wants to know about your anesthesia provider is that if he doesn't see him or her, it's a good day. It means you've had a good day. I always tell the students that are with me, if you stand up, they think that there's a problem. So you make sure you always sit down. And then just open communication. There's been plenty of times where I've, looked over the drapes and said, if you could stop killing this guy, it would be nice, And I'm like, get your hand out of that and fix that bleeder, please, because we're not having a fun time back here. So it's open communication, because I'm not directly looking at the surgeon or surgery, and I can't see down there, and I need them to be open with me and have a good relationship to say, Brad, I'm getting into some bleeding up here. Okay, well, now I know if my blood pressure's low, I'm low on blood, need some volume, something like that. The squeeze isn't going to work.
Wow.
Well, my blood pressure's up right now just hearing this, okay? But we're going to take our first break, so I can go over here and lay down for a minute. But, listen to Brad Pyron. He's a CRNA with St. Thomas West, right?
Yes.
And future son-in-law to my buddy Wayne over here. But we'll take our first break. Be right back with you in just a minute.
Whether it's a cough, a fever, or something you can't quite name, MMC Now makes care easy. Walk right in, get seen quickly, and your visit connects directly to your MMC doctor. Care you trust, with providers you know. with digital check-in and multiple locations around town. MMC Now is here when you need us.
Murfreesboro Medical Clinic.
Lace up your best kicks for a night of impact benefiting First Shot. Join us for the annual Sneaker Ball presented by Venture Express. Spend Sunday, April 26th with NFL Hall of Famer and Super Bowl MVP Marcus Allen. The event kicks off at 6 with a VIP meet and greet at 5. Reserve your table today. Call Coach Andy Herzer at 615-631-5312. We'll see you at the Sneaker Ball benefiting First Shot on April 26th.
Choosing the right insurance can be overwhelming. That's where Recall at Rayburn Insurance comes in. At Rayburn, we're not just about policies, we're about people. Recall will take the time to understand your needs and find the best coverage at the best price. We've been serving our community since 1973. So why not let Recall take the stress out of insurance? Recall at Rayburn Insurance Agency, where you're more than just a policy number. You're our neighbors.
Good Neighbor Events is brought to you by Old National Bank, the law offices of John Day, and AmeriCare Pest Control.
Hey, I'm ordering dinner. I was thinking burgers.
Boom! I just earned a $600 bonus for opening up a checking account at Old National Bank. Sorry, what'd you say? Burgers?
No, I definitely said 40-ounce dry-aged tomahawk steaks. Yep, with those little sauteed mushrooms.
Earn up to a $600 bonus when you open an eligible checking account and complete qualifying activities. Visit oldnational.com/checking and get old. Member FDIC. Additional restrictions apply. Offer valid through June 30th, 2026.
Now, WGNS Good Neighbor Events. The Rutherford County Library System is offering free computer classes over at the Technology Engagement Center. That's known as the Tech Center, TEC. For information about those free computer classes, get with the Tech Center. There is a grief support group every Wednesday morning at 10 at the St. Clair Senior Center in Murfreesboro. Sometimes getting together with others who are facing similar challenges is a great way to move forward. Once again, there's a free grief support group every Wednesday morning at 10 at the St. Clair Senior Center. That's at 325 St. Clair Street, near the Murfreesboro Square. And the Knights of Columbus Fish Fry is over at St. Rose of Lima Catholic Church every Friday night from 4:30 until 7 through March 27th. Oh yes, don't forget the Rutherford County Beekeepers Association meets on Monday night, March 2nd, 7 o'clock in the evening at the Lane Agri Park. That's the Rutherford County Beekeepers, Monday, March 2nd, 7 o'clock in the evening at the Lane Agri Park. Those are WGNS Good Neighbor Events.
Rutherford weather.
More clouds than sun today with daytime highs approaching 50. Cloudy tonight, lows dip down to about 41. I'm meteorologist Jennifer Wojcicki on News Radio WGNS. Right now, it's 26 degrees.
WGNS is powered by Middle Tennessee Electric. If you've recently changed your phone number or email, make sure you update your details at MTE.com. It's the best way for MTE to reach you quickly with important outage updates.
This is the Roundtable from News Radio WGNS on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
And welcome back to Tuesday Mornings with Rick and Wayne, and certainly our pleasure this morning to have my future son-in-law, Mr. Brad Pyron, who is a CRNA with, Rick will tell you I always have
it's hard to
faux
say
pas,
anyway.
with St. Thomas West.
Correct.
And we're, we've taken a little curve this morning. A lot of times we talk about politics or children welfare, but actually diving into health this morning. And thank you for being with us. Something we talked about off air, these new drugs that I think they were developed to help with diabetes,
Correct.
but people are using them for weight loss
Correct.
opportunities
Yep.
now.
GLP-1s, Ozempic, Mounjaro, Jardiance. They even have pill forms of them now that you take daily. Ozempic's, everyone knows the Ozempic name. It's an injection you take once a week. It's had pretty large, we've had issues with it with anesthesia. And, a normal person would think, how does my diabetes and weight loss have anything to do with me going to sleep next week? But we have NPO guidelines, which just means you don't eat or drink anything the day leading up to surgery. So nothing past midnight. Now, the way Ozempic and all these other GLP-1 medications work is it slows down your gastrointestinal system. So anything that's in your stomach, you feel full sooner, so you eat less. That's how it works. That has become initially when these things came out and everyone was taking them, we had issues with patients coming in for surgery. They hadn't eaten anything since midnight, to today, but their stomachs are still full because their body hasn't gotten rid of their contents. And excuse me, and these medications that I give you, normally you're not burping up or you don't just walk around and feel sick to your stomach all day because your muscles keep everything down in your stomach and work it only one way. Well, I give you medication that makes all those muscles stop working and you're laying down flat and anything that's in your stomach come back up. And the one place we don't want it to go is in your lungs.
Sure.
That's
right. That causes a lot of problems. Aspirations, what you breathe in or get things in your lungs you don't need it to be. It causes pneumonia. Causes a lot of problems.
Are these medications that people will stay on for will they eventually get to a point they'll come off of them?
I think it's kind of gotten to a point that more people are taking them for weight loss and they're taking them for the intended purpose of it, of helping with your A1C, which people know is, your average blood sugar for 90 days. And people are taking these medications that you wouldn't even think should be taking them. You see this, middle-aged woman who's not obese by no means is still taking the Ozempic.
Right.
You don't necessarily need insurance approval to get it. It's just a lot more expensive at that point. I know we've kind of, at our hospital, and I think around the country, we've kind of gotten to a point where we've kind of had to set guidelines. And, the issue with this is we didn't have guidelines when this all came out. Understood how it worked, but it's the first time seeing it, and we've gotten to where we've talked with the surgical teams and stuff like that. Because again, I'm only seeing you 15 minutes before surgery. I'm not calling you a week before and saying, make sure you take this drug and this drug and this drug and don't take this one. And had to be very open lines of communication with these surgeons and their offices to let these people know not to take that medication a week prior to you coming into surgery.
I know because I'm on a full aspirin. Mm-hmm. They tell me to quit 7 days before surgery. What other things out there? And you don't think of an aspirin being that big a deal, but what are some of the other things that, especially a senior, might be taking?
Well, I think another thing that's kind of when we ask you, what medications do you take? I think that also should include any, outsourced things, minerals, vitamins, stuff like that. Some people take these multivitamins that have things in it that also help thin your blood out and don't realize it.
That's right.
And, when we're asking you what medications you take, we're not judging you on if you take 50 of them. It's just, if I know that you're taking all these medications, I deal with Plavix a lot because a lot of the people I take care of have stents, and you have to take Plavix. you got to stop that a week before.
Mhm.
If you don't stop that medication a week before, no one catches it. The chances of your blood clotting off are a lot lower. And if I don't know that you've been on that, I can't reverse it. And
Wow.
time is of the essence a lot of time in surgery, and you need to know what you're dealing with all the time, and not just kind of throwing darts at a dartboard trying to figure out what it
Yeah,
is.
I wouldn't. Yeah, happenstance is not where I want to be in surgery.
No, it's not a fun place to be.
This is kind of an outfield question. You were in baseball, so it might be in your alley a little bit. But my daughter has alpha gal.
Okay.
She got a tick bite.
Yeah.
And it's like, I have horses and we camp a lot and we do things. And I have several friends now that have got that. And it's like I don't know, it's one of the leading new things that are out there, and there's nothing for it. And
Correct.
if you have alpha gal, it does away with dairy products. It does away with red meats.
Yep.
Any animal, anything you can't eat, none of it.
Right.
And that's just a regular tick?
Yes.
It's not a particular tick?
Just getting a tick bite, and it changes your life because you got to change your diet. And there's not a medication per se that's been found, and the only thing really they got is she's doing these ear things now where they put acupuncture in your ear, and then you have to have a metal rod, and I guess when they hit the right spot, your arm don't move, and it's a lot of I don't know, man. It's just
like
weird
something
medicine.
like witch
And certain
doctor.
herbs and things that people are taking now and doing
Wow.
things, but how do you deal with a person like that? Because it becomes an issue with what medications they can even take.
Again,
It affects her on dyes like red dye 40
Right.
and things like that. now.
Right. So we see that quite often.
Yeah.
One of the medications that we can't give people with alpha gal is heparin. And heparin's a blood thinner. That's what we use. We give a big dose of heparin to get you on bypass, so your blood doesn't clot. 'Cause your blood can't clot when you're on bypass, because that would clot the bypass circuit and not be a good day. But there are other medications that we would have to give in lieu of that. One of the medications that we use is Bival or Angiomax. Problem with those medications is there's no reversal. So if I give someone heparin, without the alpha gal, I give myself heparin, or give someone heparin that doesn't have alpha gal, I can give a reversal medication called protamine, and I can get, we see how long it takes to clot. We use this thing called an ACT. It's activated clotting time, and dose the protamine based off that. How much of protamine or reversal of a heparin. With Angiomax and Bival, it's time. So, those are things that you have to be cognizant of, because if you give someone with alpha gal a big slug of heparin, not only are you going to have, somebody that's now blood is really thin, but they're going to have a huge histamine response.
That's right.
Allergic reaction, which is just a big histamine response.
And it can be up to 8 hours later.
Yeah.
She can,
Oh, wow.
she can unfortunately order some kind of taco or something and want a veggie one or something, and it may have touched or been in the same bowl or where they had cooked beef in.
Well, like beef broth.
You're done. You can't have any of that.
Wow.
I mean, you got to completely change your diet. Well, Thanksgiving is a whole new world for my daughter because of the things that we're a traditional family, and it limits a lot of that. The butter, you can't use real butter. You got to use, alternative to butter. So it's amazing. But so how often do you have to, like, your re-up? So we're in the insurance world, and he's the grandfather now. He doesn't have to take his test like I do. But how often do you got to go back to school? Because we're every 2 years. So
right. So I have to.
Y'all are like every 6 months because all y'all do, right?
Well, so I have to renew my license every 2 years. Every 4 years, I have to go submit everything to the board, my anesthesia board, make sure I have all the education hours. I have to have 100 hours of continuing education every 4 years. I also have to check I'm not entirely sure if my year I have to also retake boards again, and you have to do that every 8.
Ouch.
So that'll be a fun next year because next year will be year 8 for me.
Yeah.
So
We're
retaking
getting-
boards.
We're getting close to the end. We still have some conversation, but you better give some shout outs before you.
Who you got watching?
Well, all
will
four
be
of the,
watching.
all 4 of the kids, Riley, Oliver, Lanning, and Layton. Maybe they've made it this far. I'm not sure, but my beautiful fiance Hillary, and then also very blessed to have the family that I do have so close to me.
Nana, Poppy, and I call his sister Ms. Pyron because she's a teacher. So I have to show my respect towards education.
Yeah.
So, but they are all such treasures.
Yeah. My mom was bragging on my sister, getting.
Aren't you tired of that?
I mean,
I
wanted. She posted an Instagram picture of my sister of like getting the high honor of teacher and all that stuff, and I was almost commented on there and said, "One of these days I'll make you proud too." But we'll get there eventually.
That's right.
Kind of like the black sheep sometimes.
But I tell you, just when we're all together, it's always such a great time, and especially the 4 kids running around like a band of Indians and stuff like that.
There's no boredom at my house.
Do you still have any old trophies left?
If I do, it's at my parents' house, and they might have got rid of them. I have no idea.
Well, there's VIP awards in Smyrna. Have Wayne go by, and he can get you one, and we can have your name tag, and you can go set it on their mantle and say, "Hey, look what I got today." It helps a lot because I know how you feel. I'm the youngest, so but I know exactly how you feel sometimes.
Yeah.
Rick, let me do the public service announcement again for Isaiah 117.
Okay.
For the Streams of Hope fundraiser, a night with Craig Campbell and friends, and it's March 24th from 5 to 8 at the Walnut House.
Which is tonight.
March 24th.
Oh, March. I'm sorry. Yeah, you're exactly
March
right.
24th. I was going,
Hey.
I've lost a moment. You had me there, bro. And but you can go online to Isaiah 117, and we've like I said, we've had them on the show, and they're basically a pass through from being taken out of a dangerous situation with DCS and put in the house, which is extremely nice, where they can get a shower, clean clothes, food, relax, sleep, and until they're placed either with other family members or in a foster care environment. So just a neat group, and we try to promote them because Rick and I are all about trying to find opportunities to assist those children that need our assistance.
Well, DCS just did a thing on Capitol Hill where they were testifying, and they're still having kids spending the night in DCS centers. So a program like Isaiah 117 is growing across the state of Tennessee. It started up in Kingsport, Tennessee, but they're in, 9 other states, I believe, or there's several.
Yeah.
But it's something we kind of need in every county here because they're still, unfortunately, having to do that. And I dealt with that all the time when I was a detective, that we'd have them sitting in interview rooms, and I could have a murder suspect in there 2 days ago, and then all of a sudden I've got 2 kids in there sleeping on the floor because we're in a situation they're in. And that program that they do to get them out of that just for a little while is amazing. And they clothe them, feed them, give them good rest, new clothes, toys. It's pretty awesome.
We talked about your credentials, but I don't know that we talked about how long the education process is to get to do what you're doing.
7 years post high school, so 4 years undergrad, bachelor's in nursing. I personally have a master's degree in anesthesia. They've kind of made it across the board where it's a doctorate degree, which adds another 8 months. So I guess a total of 7 years after high school, and a lot of free work. while you're in anesthesia school, is what we say.
A lot of bills, right?
Yeah.
That's the problem.
Yeah, it's not cheap. I think what I hear some of the students say, what they pay for schooling is twice as what I paid not that long ago. It's getting close to $150,000, $200,000 to.
Well,
do
God bless
school.
you for what you do. I'm pleased that you and your associates have the training and the knowledge that you do. Because when I go to sleep, I want to wake up.
Yeah, exactly. We have a good group.
Well, hey, I want to give a shout out the last minute here. Mike Sparks, state representative, I've brought up on the commission now several times that the Department of Corrections won't build new prisons. So we're having to house hundreds of state prisoners in all of our county jails, and they only pay us $40 a day, actually $41. And it costs us $103 a day. So we're weighing the whole for every prisoner. And as of yesterday, we had 177. So it costs us $11,000 a day of taxpayer money to house state prisoners that the state won't take responsibility for, and they can leave them there up to 6 years. But he did a good fight for us yesterday up there, and he just sent me a text message just ago, and he's sitting in front of the T-deck with the landfill. So he is up there fighting for us, and we got a unified front with all of our leaders here, and I appreciate what he's doing.
Thank you for your service as a commissioner, and I'm pleased that you'll be with us another 4 years. And thank you for fighting the good fight. And I don't say this about many people. I think I can probably count on one hand. But my friend, you ooze with integrity, and thank you for serving as commissioner.
Thank you, Wayne. You got an awesome future son-in-law here.
I do.
I'm glad to meet him, and amazing guy.
And great family to go with it.
That's right. Exactly. Well, everybody, I hope you enjoyed our show. And Brian's coming up next. Looks like we got grain coming in. It kind of scared us when he brought it up on the radar back there. It was blue.
It was blue.
Whoa,
I did
hey.
not like that color.
But anyways, have a great week, and we'll talk to you next Tuesday.
Joe Fallon.
Whether it's a cough, a fever, or something you can't quite name, MMC Now makes care easy. Walk right in, get seen quickly, and your visit connects directly to your MMC doctor. Care you trust, with providers you know, with digital check-in and multiple locations around town. MMC Now is here when you need us.
Murfreesboro Medical Clinic.
Subscribe to Big G TV, local content that matters to Rutherford County.